All right, welcome back. We're talking with Dr. Sarah Haydale about sun safety, and we're going to continue our discussion. Terrebonne General Medical Center, of course, you're on staff there. What are they doing to promote sun safety and some of the things that are important to get out on this topic?
I'm really proud of how they sponsor a lot of free skin cancer screenings. They're actually having one this coming Tuesday, May 25th, from 10 a.m. to 2 p.m. It's going to be held at the Walmart on the east side. Anybody who is 18 years of age or older that has no health insurance, that has not seen a physician in the past 12 months is eligible to come. Mm-hmm. There's no fee, there's no appointment necessary, and we really do feel that 5 minutes can save somebody's life.
And I see it on the...
Because within 5 minutes you can be looked at from head to toe, and detection really is the best cure for this. If you catch any of these skin cancers early enough, you can be cured.
That's pretty incredible. I didn't know in 5 minutes. That's a good rule of thumb.
5 minutes. You can take 5 minutes every year.
Everybody should have 5 minutes.
Everybody
a year, right?
has 5 minutes.
All right. What is the deadliest, the most deadly form of skin cancer?
Melanoma is the deadliest, and these are the ones that start out as usually like a dark black mole that's usually bigger than a pencil head eraser, which is 6 millimeters. That's either changing in size, bleeding, pops up out of nowhere. Melanoma is a tricky skin cancer because the body doesn't recognize it as being abnormal. So it doesn't respond very well to chemotherapy and radiation like other cancers can. So basically, if you can't cut it out, it's hard to cure you. And that's why the smaller it is, if you can completely remove it, then you're cured.
Okay.
So that's why we really like these screenings, because you can catch something when they're tiny and then you can cure the problem.
And I guess by now we've all heard of melanoma. You know,
Correct.
It's been a good marketing campaign to get that out over the years. So
I mean, even though it accounts for only 5%, you know, of the deaths for skin cancer, it's still, you don't want to be in that number.
Okay, I didn't know it was only 5%. Symptoms of sunburn. Now, I know what mine are. It burns like heck. All right, but what is it? What's the best treatment options for it?
If you just have a mild one where you're a little pink, a cool bath, maybe with a little aloe vera, the old-time remedies. As it gets more severe with blistering and pain, some people can even get fever and nausea, and we could call it the old-time sun poisoning. So the higher the level of the intensity, you can do anti-inflammatories like Motrin or aspirin. We use over-the-counter cortisone creams like Corday 10. Every once in a while we got to give people cortisone pills by mouth. The swelling is that severe. But if you have symptoms of nausea or you've passed out, then that's when you really need to seek a doctor for attention.
Did you say sunburn poisoning?
Did you ever hear that?
I never did. First time I've ever heard
Yeah, that's a kind of an old saying that my grandmother used to say. She'd say, yeah, you're going to get sun poisoning. And that's when people would actually pass out from laying out on the beach all day, falling asleep, and then they actually would run a fever and go to the hospital, and their diagnosis was
a good term, though.
Sun poisoning.
Get nauseated and all from it. Yeah, I've never heard it called that. But
sounds like a fun day at the beach, but
or an unfun day.
Or unfun day. That's right.
What tips can you share to help people out there who may want to help you promote sun safety, or they're just learning about it? How can you help promote it?
We tell people to try to stay out of the sun between the peak hours, which is really about 10 a.m. to 4 p.m., which is hard to do because a lot of fun activities happen during that time. So if you're going to be out during that time, try to wear protective clothing. A lot of the kids' swimsuits now, and even clothing for men, has the sunscreen built into the fabric. That technology is really cool because then you can be actually wearing the sunscreen in the clothing. You still have to apply it to your skin as well, but it's just one more thing you can do. Wear a hat. You know, a hat with a 4-inch brim really protects the entire face. And a lot of men, the top of their ears are always affected. So don't always forget to put, you know, the sunscreen there.
Always get those farmer's tans.
The farmer's tan?
Yeah.
Yeah, so hats, clothing, sunglasses, don't forget about your eyes. You know, the UVA rays that I was telling you about that penetrate deeply, they can start to cause damage in the eye over time as well. So all of those things can add up to having a fun day outside, enjoying yourself, but not increasing your risk of problems down the line.
I guess everything in moderation.
That's right.
It says 10 a.m. to 4 p.m. I would assume morning sun and evening sun, going sunsets and sunrises
is the best time if you're going to be a jogger, you're walking, you want to do a lot of, you know, working in your yard. So just try to pick those times because it's just less harmful to you.
Well, Dr. Sarah, thanks for coming on tonight.
Thank you for having me.
Good to see you, and congratulations on your new office.
Thank you. Appreciate it.
All right. We'll take a break. When we come back, we're going to be in the kitchen with Kanata, so you won't want to miss it. Don't go away.